Welcome to The Being Guide, the lifestyle podcast that celebrates diversity of thought on all things health, wellness, and being. I'm your host, Charlotte Horn. Join me as I indulge my curiosity through candid conversations about health and life, with people who represent a whole spectrum of ideologies on what it means to be well. I'll be finding out what being means to each of them as they generously share their stories and leave us with insights that can be applied in the context of our everyday lives. Together, we seek to make sense of the paradoxes, raise awareness of the resources, and normalize conversations about the things that we are all thinking and feeling. It's not a one-size-fits-all, so take what you need and enjoy the show. I'm joined today by Sarah Ramey, an author and musician living in Washington, D.C. At the age of 21, Sarah started experiencing mysterious symptoms following a botched medical procedure. Debilitating pain, incapacitating exhaustion, and brain fog were but a few of the symptoms that dominated her existence from that point on. Her pursuit of a diagnosis led her to seek the help of over 150 doctors and specialists, the majority of whom could not find a cause and dismissed her condition as psychological, suggesting that it was all in her head and prescribing a cocktail of antibiotics and antidepressants. It became clear that mine was not a psychological condition, said Ramey. It was a problem in the psyche of the doctors. The programmed assumptions, unconscious bias, prejudice against this type of patient, particularly against women. After years of mistreatment and prolonged suffering, made worse by the incessant gaslighting that accompanied her search for a diagnosis, Sarah had a breakthrough in 2012 when a female physician took her case seriously. Soon after, Ramey discovered functional medicine and found a doctor who gave her a long-awaited diagnosis of chronic fatigue syndrome, complex regional pain syndrome, POTS, and fibromyalgia. Although shocking, Sarah learned that her experience was not unique, as she uncovered a whole community of people who had experienced the same mistreatment at the hands of those who they placed most trust in. This was both a tragic and unifying revelation, and one which galvanized her into creating a community of women with mysterious illnesses, or WOMIs, as she calls them. Sarah went on to speak to hundreds of WOMIs and began to piece together stories, research, and conversations, all of which have contributed to the masterpiece that is The Lady's Handbook for Her Mysterious Illness. Released in 2020, The Lady's Handbook is Sarah's refreshingly honest account of these events. Her humor, sincerity, and tenacity translate into a read that had me laughing, crying, and cringing simultaneously. It delivers hope without sugarcoating and has done the world a service by bringing illnesses that are often accompanied by air quotations into the spotlight. Sarah is also a songwriter and musician who goes by the name of Wolf Larson. Her 2011 album, Quiet at the Kitchen Door, features a series of haunting poetic vocals accompanied by soulful strings. Today, we'll be delving into the world of mysterious illnesses, discussing the importance of self-advocacy, reframing the hero's journey, and peeking into the game-changing world of functional medicine. Sarah Ramey, welcome to the show.
Thank you so much. That was such a wonderful introduction. Thank you.
Oh, as I said to you, I hope that I've managed to condense your entire life's journey into a few paragraphs, but no doubt
better than I can do.
Not at all. And I'm sure I've missed out some key steps. So I might just get you to give yourself a bit of an introduction and let listeners know your journey with mysterious illness.
Sure. So the way it began for me, I just turned 41, but this started for me when I was 22. So I was the senior in college. I was super active and healthy and, I hesitate to say normal, but I mean normal. Like I really had no physical challenges that were significant. I had maybe some nagging issues, but really nothing at all. And the summer before my senior year of college, I got a urinary tract infection, which I'd never gotten before. If you've never had one, they are very painful. And,
yeah.
I went to go get treated for that, took some antibiotics, and it got better, but not 100% better. And it lasted for the next 6 months. And so that's much, much too long to have a urinary tract infection. And so I finally was sent by my parents. I went home for Christmas break. My parents are both doctors, and I told them that I had this going on, and they said, "Oh, you need to go see our good friend and colleague, Dr. So and so, and in the book we call him Dr. Damascus, and he'll sort you out. He's the best urologist in town." And so I go see this guy. He says, "No problem. I know what to do here. You don't really have a UTI. You just have muscle spasm, and so I'm going to perform this procedure where I stick this instrument inside the urethra, stretch it or rip it a little bit, and that solves the problem." I was like, that doesn't sound great to me. But he was like, "Oh, it's no problem. And I just did this on a 90-year-old woman down the hallway. Put your big girl panties on. This is going to be fine." He really did say, "Put your big girl panties on." And so, yes. And so I was like, well, okay. I was like, if the 90-year-old woman did it, I can do it. And so I saddle up in the stirrups and we get started. And he had said, he was like, you may just experience a little discomfort, but, a tiny amount of pain, but it's really nothing. Like, okay. And so he began, and it was like being hit by a bolt of lightning or like having a knife put into your vagina. It was so, so painful. And I start crying and screaming and making this huge scene. And he got very upset with me, to basically stop making such a scene. He was quite annoyed that I was like making a mess of his procedure. So this whole sort of thing happens between the two of us where I'm upset. He's treating me like I'm being a baby. And I'm really horrified in this horror. And he multiple times went back in with this instrument, and it was extremely, extremely, extremely painful. And then when he was done, he just handed me a box of tissues and said, clean yourself up. You're done. You can go home. And he walked out of the room. I'm like sobbing because obviously, as anyone would be if you felt like somebody just stuck a knife in your vagina. And I went to clean myself up and I was bleeding. And I, was concerned about this. And I told him, I went to his office and he was like, "Oh, what do you want? A maxi pen?" And so he just treated me like I was being so hysterical. And I really internalized that. I was like, okay, I am being hysterical. I need to put my big girl panties on and go home. And so I did. I went home. I was in a lot of pain, but also was starting to feel quite unwell and was really confused as to what was happening. And so I went to bed and I woke up in the middle of the night and I had a sky high fever. My muscles were clenching and unclenching. I was making a noise. I was very, very, very sick. And so luckily I was at home and I went down to my mom's room, and she's a doctor. And immediately, I sort of told her what's going on. And she grabbed me by the scruff of my neck and dragged me to the hospital. She's like, "You've gone into septic shock," which is an infection of the bloodstream. And so I hospitalized immediately, put on an IV of antibiotics right away, which she was right. I had gone into septic shock, which the treatment, as long as you treat it right away, antibiotics are life-saving. And so I was kept in the hospital for a week. My life was saved. And that doctor did come in to see me in the hospital, but his attitude was, I have no idea. That was a completely normal procedure. I have no idea how she could possibly become septic. This is baffling. And that was, because this is a good friend of my parents, this is how we all sort of internalized what was happening was, gosh, what a strange mystery that we will probably never get to the bottom of, but hopefully, this is just a blip. But as the days went on, as I said, I had been completely healthy and normal before this, starting with obviously becoming septic and being in the hospital. All of a sudden, I was sleeping 20 hours a day. My muscles were burning and aching. My colon basically stopped functioning. I was unable to poop on my own. And I had this unbelievably severe vaginal pain, which I had had pelvic pain prior to this because of the UTI, but this was much worse. So I had all these new symptoms, but in the hospital, they're like, "Well, you just almost died. I mean, it's that, and everything is fine." They did run some different tests to try to see what crazy thing could have caused me to become septic. But they just said, "Go back to school." They sent me back with a PICC line, which is like a portable IV of antibiotics. They're like, you're young, you're going to be fine. You're going to bounce back. Everybody bounces back. And so I went to school and I did not bounce back. I was barely able to attend any of my classes. I was sleeping constantly. I was in so much pain. I was crying constantly. My muscles were burning and aching. My brain felt like it had been filled with 10 pounds of sand, like with severe brain fog. I couldn't read. I couldn't concentrate. So I was really sick. I felt like I had the worst flu of my life, plus all this pelvic pain, plus my colon stopped working. Obviously, I was not bouncing back. And so for the rest of, essentially for almost the whole rest of the year, we spent with me going back and forth to doctors, to Washington, D.C., to being pulled out of school to go see more doctors, to try to figure it out. In the beginning, it was, what in the world is this rare tropical disease? You know, what could possibly be afflicting this young woman who was so healthy and normal not 10 minutes ago and is so sick now? And I mean, they looked for everything. They looked for cancer, they looked for AIDS, they looked for dengue fever, they looked for absolutely everything and couldn't have taken it more seriously. But as all the tests came back, you know, negative, 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 a new attitude started to emerge, which was sort of crystallized by this one urologist who performed this very difficult procedure that was negative, that didn't show anything. And instead of just saying, I don't know what's going on here, he called my parents in who had taken me to the appointment. And he said, you know, Dr. Ramey, Dr. Larson, he's like, I think one thing that we need to consider here is that Sarah's problem, like so many young women her age, is psychological. And I was sitting right there. And I remember he had just performed such a invasive, painful procedure with like catheterization and just really horrible procedure. And for him to just sit there and say that, not to me, but to my parents, not even looking at me, was this real turning point, because it was sort of where everything shifted from really trying to get to the bottom of what was wrong with me to this new diagnosis of this is a hysterical young woman. And that can be the only logical conclusion here in the absence of any data. That really started to take hold with the majority of my doctors. And there's like a variety of ways that comes across. Sometimes they say that to you. Sometimes it's just clearly implied with the way that they're treating you, et cetera. And so that was the beginning of this 20-year journey of having a, quote, mystery illness where you, the patient, are 100% sure, or I should say like 90% sure that you're sick, 100% sure in the beginning. But as people start to chip away at that and say, no, you're not, no, you're not, no, you're not, you know, percentage points start to fall. And you're like, am I not sick? Is it possible that I feel so sick, but they're telling me I'm not? Maybe I'm not. It's very disorienting. And so that was how this began, was where, and I really thought that I was the only person on planet Earth that this had ever happened to. And then, you know, as we get into in the book, a couple of years into it, you know, I meet my first WOMI, or another woman with mysterious illness, same exact story in broad strokes. And then I meet WOMI number 2 and then WOMI number 3. And slowly I start to realize like the veil is lifted and I'm like, oh, this is a huge community of people that don't just have similar symptoms, they have the exact same experience of life, of being sick, of being kicked around in the medical system, of being treated poorly by the people you love the most. Your friends and family will often treat you pretty badly if they don't believe you. And so that was how all of this began, in terms of starting to think about this as not a phenomenon unique to me, but something that was really quite a large collective phenomenon. And that's really what the book is about.
Yeah, thank you for summarizing your experience so articulately. I think it's an incredibly, as you kind of mentioned, it's this sort of realm that is often accompanied by the air quotations and the blank looks, and just it's operating in an area where gaslighting is so prevalent. And like you said, it gets to a point when you actually do just start to question yourself and your own sanity. I guess you've come up against your fair share of, I guess you could call it trauma in the medical world, being gaslit and just general malpractice mentally and physically. Why do you think it is that this keeps happening?
So, my analysis, which is just my analysis, but this is what I strongly believe, is that it's really because of, it's a little more complicated than this, but predominantly it's because of these two main factors. Number one, it's the intersection of these two main factors. Number one, most of the symptoms of a mysterious illness, so whether that's chronic fatigue syndrome, fibromyalgia, postural orthostatic tachycardia syndrome, Ehlers-Danlos, Lyme disease, et cetera, this sort of family, these are, I'm listing some of the quote unquote mystery illnesses. Mm-hmm. The predominant symptoms are invisible. They're pain, fatigue, brain fog, gastrointestinal issues. You cannot prove to anyone that you have those problems except by making a face. And making a face is not enough to prove to somebody that you have a problem. It's different than having, a big boil on your face or a large tumor or losing all your hair or having a severe limp or something that is sort of incontrovertible, that you are essentially protected by this external evidence that can't be refuted by the person sitting in front of you. So you've got, on the one hand, these invisible symptoms, and invisible does not mean not bad. Like invisible symptoms like pain and fatigue can be extremely debilitating, but they are invisible and non-provable. And then the intersection of that, and then the vast, vast majority of the patients that have this type of problem are women. And that's also incontrovertible. The ratios are, it's like 3-to-1, 4-to-1, 5-to-1, female to male in most of these disease categories. Also, the stepsisters of the true mystery illnesses are the autoimmune diseases, which frequently having an autoimmune disease, it takes a really long time to get diagnosed, very similar symptoms. You do end up with a diagnosis, which is like a luxury, but it's a very, very similar kind of experience of illness, from the symptoms to the experience of the medical system, et cetera. All of these categories are all 3-to-1, 4-to-1, 5-to-1, female to male. And I think that from my perspective, that's the reason. I think that if you just had the gender imbalance or the sex imbalance was the only issue, but you had visible symptoms, I think this would not be nearly as bad of a problem. Mm-hmm. But when you have a problem where you are taking the enormous unconscious bias that exists in a lot of physicians against women, not just women, people of color, any marginalized group, there's so much unconscious bias in medicine that it really needs to reckon with. But women, that's one of those groups. And there's a huge amount of bias against women that is well documented, that is sort of exists from the beginning of medicine. It is sort of the history of women in medicine is to be disbelieved by your physicians or to have your very real illness misconstrued as some type of hysteria. And so I really think that that's what it is that those two problems, because I think that if you reverse the ratios, if this was mostly men were having these problems, we would have solved this a very long time ago.
It might be a bit more funding, hey?
That's a very difficult thing to prove, but I think that most people I know, especially who have had an experience of this, if it was mostly men that were going to their doctor and saying, I am completely incapacitated, and they were seeing man after man after man after man come in, they would say, oh my God, what is this scourge on the young men of today? Instead of saying like, oh, well, men, just a bunch of complainers and liars, And when you say it like that, it's like, yeah, right, that wouldn't happen. It just wouldn't, but it absolutely does happen with women. And it's interesting. A lot of people who are not in medicine have that same bias against women. They're like, well, women complain about their health a lot and are nervous Nellies and blah, blah, blah. And every time somebody says that, I'm just like, I think we'd have like a few layers of bias that you're not aware of, right? That's why it's called unconscious bias that needs to be excavated.
Yeah, absolutely. And why do you think that it does disproportionately affect women? You mentioned some really interesting stats in your book, one of which I picked up on, which is that women naturally synthesize 55% less serotonin in the brain than males. Does that have something to do with it?
So in the book, I write a little bit about starting to areas that we might look to start trying to understand this, because I don't know definitive. If I knew the answer to definitively, I would be receiving a prize. Nobody knows the answers definitively. But for example, like a lot of people who research this problem, there does seem to be a problem in the limbic responsiveness of the way that your brain is responding to stimuli, and especially to stress and negative input around you, and that something is changing the way that the brain is responding normally to the stresses around you. And this is one real difference that we already know between the female brain and the male brain, is that we process stress differently. And so this is very clear in the book. When we talk about the relationship between stress and these illnesses, I'm not saying, oh, just meditate, or like this is all stress, or just trying to condense it down into this is all just like an emotional issue. That is not what I'm saying at all. But when we start to look at what's going on in the brain, where it's causing this sort of inflammatory cascade in response to stressors, the male brain and the female brain really are different in the way that they respond to stress. And so this is, I think, one way that we can start to think about, well, why is this affecting more women than men? So one of the other things we talk about in the book, just to take one example, is that things like gut dysbiosis is pretty clearly correlated with development of chronic fatigue syndrome, fibromyalgia, autoimmunity, et cetera. And we know so gut dysbiosis is an imbalance of good flora to bad flora in your gut. It's called the microbiome. And we know that gut dysbiosis can cause some neuroinflammation called microglial inflammation in the brain. And so that registers, we also know this, that registers as a stress in the brain. And so this is what I mean of, so let's say you have this ongoing gut dysbiosis where your gut flora is imbalanced. You are totally unaware of this. Maybe you've got a little bit of IBS, but you don't realize that there's any real problem. Certainly that it could be affecting your brain, certainly that it could be affecting your brain in a long-term way where it's actually changing the way that it responds to the stimuli now around you in a different way because of the underlying gut dysbiosis. And so this is, I think, one stab in the dark that I think is based on some of the data that's available of why women are more affected by this problem. If you introduce gut dysbiosis because you change the diet and you give people a lot of antibiotics, and then that leads to a type of neuroinflammation, low-level neuroinflammation, and that registers as an ongoing abnormal stress in the brain. The female brain, because it responds differently than the male brain, may respond differently and may start to develop a disease process that the male brain simply doesn't with the same underlying conditions. Does that make sense? This is like very complex, but I think that that's one example of, if you change things in the environment, it's going to affect different organisms in the environment differently. And this is one of the reasons I think it is important to take seriously some sex differences in terms of the ways that our bodies are different. That has nothing to do with gender, right? That this is not about how you express gender or sexual orientation or anything like that. Just that the female body and the male body just have certain things that are a little bit different, that are really important to isolate, because they can tell us things about why the female body or the male body develops a disease that the female or the male body isn't developing, at least not developing as quickly.
Yeah. Thank you for explaining that. And I think just to kind of take a step back and set the scene a little bit for those who might not be very familiar with what kind of chronic illness is, I guess how big of a problem it is and how it can play out in people's lives. Can you just start by telling us a little bit about what, at its core, chronic illness is? And then I guess let's go into how much of a problem is this? What's the impact that this is going to have on society if it continues to go untreated, or it continues to go misdiagnosed, or it just continues to be taken less seriously than other more overt conditions?
Right. So one thing to distinguish, so there's chronic illness as a whole, and I actually mostly only know the stats in the United States, so I'll just use that as an example. In the United States, I think it's over half of all Americans have chronic disease at this point. So that's an enormous number of people.
Wow. My
Yeah. But I want to distinguish between chronic illness and the mysterious illnesses. These are not the same thing. Diabetes is a chronic illness, but is not a mysterious illness. Your doctor doesn't say, I think you've got, I know you think you have quote unquote diabetes, Ms. Ramey, but stop Googling your illness and go home. Like, they treat a lot of chronic illnesses seriously with medications, with regimens, et cetera. The chronic fatigue syndrome, fibromyalgia, Lyme, et cetera, or chronic and post-treatment Lyme, these are not treated this way. These are treated as if they're not happening at all, et cetera, like we've talked about before. So the mysterious illnesses, if we include autoimmunity, so autoimmunity, the documented cases are about 24 million patients in the United States. But even the NIH and the CDC say that it's probably only 1 in 3 cases are actually diagnosed. So it's actually 72 million. It's closer to 72 million cases of people who actually have an autoimmune disease. So 24 million diagnosed, but it's probably at least 3 times greater than that of people who actually do have an autoimmune disease. And then you put on top of that, chronic fatigue syndrome is between 1 and 2 million patients, but probably, long COVID is very, very similar to chronic fatigue syndrome. So that number, if we want to conflate those, but that type of illness is going to be way more than 1 to 2 million, by the end of COVID. Fibromyalgia is between 7 and 10 million. You keep adding these on, it's a huge, the answer is it's a huge number of people. And, and the difference between, of course, an acute illness and a chronic illness is an acute illness is like when I had sepsis and had to be treated with antibiotics. And in a regular patient, that would have been the end of it. It would have been acute, but then it's over. And significantly more serious and more life-threatening in the moment, but is then dealt with and then done with. And in a chronic illness, you have these symptoms that are not quite as severe or acute, but that are unremitting and punishing and 24/7, or in some patients come in flares, come in waves, but it essentially is with you forever. And that's a completely different type of burden than something that's really scary and really immediate and could kill you, which is obviously very bad. But something we talk about less is how horrible and scary it is to have something that is not going to kill you, but is just going to keep torturing you for the rest of your life. And that's something that 100 million, 150 million, at least in the United States, people deal with every day. And it's quite challenging.
Yeah. And how long was it for you between the point of getting your first symptoms and then getting a diagnosis? How long was that time period?
Like a real diagnosis, they kind of batted around a lot of different, like chronic fatigue syndrome was floated early on in the first couple of years, almost as like a pejorative. It was like, I guess we could call this chronic fatigue syndrome, but you don't want to tell anybody that you've got chronic fatigue syndrome.
Yeah. There's the part in the book where you're dancing around with the term fibromyalgia, and the doctors are kind of like, oh no, we don't want to put you in that bracket because that's the kind of crazy bracket. We'll just, for your credibility's sake, we'll probably just stick to something else.
That's right. That's right. I was so excited because actually I was going to say something in the introduction. They've sort of undiagnosed me with fibromyalgia. Just fibromyalgia and chronic fatigue syndrome are very, very similar. And I think now everybody's set on just chronic fatigue syndrome for me, no more fibromyalgia, but it doesn't matter. They're very similar. I have all the myalgias of fibromyalgia. It's just that it's probably associated with the chronic fatigue syndrome. Although, who knows? With all these things, I hold it all so loosely because things shift and change so much in this area of medicine because it is so underfunded and understudied that anytime anybody is so certain about anything, whether it's their diagnosis or it's the type of treatment that they should do and that other people should do, I'm just like, whoa, you need to pump the brakes. This area is so poorly understood that for your own sanity and for the people around you, it's, in my opinion, it's better to kind of hold things lightly and to say, here's where things stand right now, but this is a pretty fluid area of scientific inquiry. And so I reserve the right to update my diagnoses because they do change. And that's not my fault. It's because medicine doesn't understand these problems very well.
Yeah. So just to, I guess, zoom in a little bit on the chronic fatigue syndrome that you just mentioned. As you said, it's a particularly illusory diagnosis in a bit of a mysterious realm. Can you just tell us a little bit more about CFS and how it manifests, and I guess your experience with that in particular?
Yeah. So first things first, our terminologies. Some people call it CFS or chronic fatigue syndrome. It's also called myalgic encephalomyelitis, which is abbreviated down to ME/CFS. So if I call it ME/CFS going forward, that's what I'm talking about. So I will frequently say ME/CFS, and I'll be talking to somebody, and like 10 minutes later, they're like, can we rewind? Like, what did you say? Like, what is that thing you said? Like, what's ME? And I'm like, oh, that's chronic fatigue syndrome. Oh, I get it. So ME/CFS is chronic fatigue syndrome. The primary symptom, as you can imagine, is fatigue, but it is not the same as being tired or being run down or tired at the end of like a long day of exerting yourself. This is this sort of mortal exhaustion that just feels like somebody has unplugged you from the eternal source of energy and just left you to let the battery run down on the floor. And you can't plug in again. Like you cannot do anything. It's actually very similar. I really relate. I always use unplugged and dustbuster metaphors because it's actually quite similar to a dustbuster. If you don't charge it, or if the dustbuster's battery is no longer working properly, you can charge it, which is like sleep. And this does allow you like this little burst of energy where it like seems like it's going to work for 5 seconds or something, and then it dies right away. I don't know if you've had that experience of a dustbuster, but I have. And
look, I've had that experience as a human being. So yes.
Yes. So this is right. So this is exactly what it's like to have chronic fatigue syndrome, which is that you recharge, but the battery does not work anymore. And so recharging just doesn't work anymore. But you frequently, until you're at the furthest end of the spectrum, which is just like an absolute hellscape, which we'll talk about in a little bit, unless you're at the total end of the severity spectrum, at the worst end, you can sort of pantomime being fine. Just like when you turn on the dustbuster, it seems fine for the first 10 seconds. And that's what it's like for me. I say this in every interview that I do. For me to do an interview, this is like the only thing that I do for the day, which is I want to do that. That's my choice to have this be like my burst of dustbuster energy for the day. But it is, I think, a little confusing because if you're not there, if like the cameras aren't on anymore once the dustbuster dies after the initial burst of energy, then you don't really understand. You're only tuning in for that first burst. And you're like, oh, it's fine. It's working again. And that's what I think it's like when people see somebody with chronic fatigue syndrome doing their like one activity of the day or having their one conversation of the day or getting groceries. And that's like their one thing. They'll be at the grocery store living in just absolute mortal fear of seeing somebody because they're going to be like, oh, you're at the grocery store. It's impossible for you to be sick anymore. Yeah. And that's, of course, not true. It's like you're doing what should be just like one activity out of 100 for most people, who go to work and have a million conversations throughout the day and take care of kids and also participate in sports and do all this other stuff. And for them, like, yeah, getting groceries, they may not feel like getting groceries, but that's like in addition to doing a million other things. For the chronic fatigue syndrome patient, that is the one thing that they can drag themselves to the store to get that done and then go home. And then the dustbuster is dead for the rest of the day. And they have to just lie in bed and do whatever. Though some people can't even watch television. It agitates their brain so much. And so that's one narrow sliver into looking at what it's like to live with chronic fatigue syndrome. It's way more complex than that. I talk about in the book, there's a real range of severity from, mild, where you're just quite aware that you just don't have as much energy as you used to. And it's on your mind all the time. You're just constantly aware that things are just not right. That's the mild end. And it's funny because I think when you're first experiencing this, that feels like the severe end. You're like, something is terribly wrong with me. This is really, really bad. And it's only experiencing kind of like each progressive stage that you realize just how bad it can get. And you almost have to like experience it for yourself. Like I remember thinking that I was farther down in the spectrum than I actually was because I had not gone all the way to the end of the spectrum, which is like you can't lift your head off the pillow. Somebody has to bathe you. Somebody has to feed you. You have to be in a wheelchair. I mean, very, 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 very sick. So as you can see, there's a huge range of how bad it can be, but it's all the same diagnosis. Now, and that's not abnormal. Lots of diseases have, stage 1, stage 2, stage 3, stage 4. And so it's the same thing here. There's just a wide array of how bad it can be. Mm-hmm. But again, because there's no marker to say you've entered into stage 2, you've entered into stage 4, it all almost looks exactly the same to people on the outside who, even if you're a 5, I say, well, maybe 1 through 5, mild through severe, even if you're a 5, if you were able to sit up in bed and FaceTime somebody, let's say your mom put some blush on you, guaranteed that person on the other end would be like, well, you're looking great. I'm so glad that you're feeling better. Even though somebody else has like propped you up and put a little makeup on for your own vanity.
That old chestnut, you look really well. And you're like, what?
Yeah.
Don't judge based on the fact that I'm vertical.
I feel like that's like my number one advocacy like platform is just telling people to stop telling people, but you don't look sick or you look really well, even if it's coming from a good place, because you're just trying to tell somebody that they look pretty, which is nice. That is a nice thing to do. You just need to understand that most people who say that really are saying it as a way to invalidate. I don't believe that you are as sick as you're saying that you are. And so if you're going to say it, you need to say, I know you probably don't feel great, but I just want to tell you, you look hot. Like, that's fine. That doesn't bother me at all. It's only when people are like, gosh, we really look quite well. And it's like this tone. Yes. And it's very, you would never say that to your friend who has stage 4 cancer. You'd be like, well, you don't look sick to me. Like you would never say that. Like, what a horrible thing to say.
Yeah.
So this is I'm constantly on this hobby horse of don't tell people that they look great. Or if you're going to do it, at least affirm that you understand that they really don't feel great. You get it. Yeah.
Yeah. I think it's great that you come up with this continuum of severity for these conditions. Because like you say, there's no scale. It's really hard to measure these things at the best of times. So that was really useful for me to read in the book. Mm-hmm. And I think what's scary about these conditions is, I guess, the fragility. And, one day you might be a 1 on the WOMI scale. And then the next day you wake up and you're a 3. Yeah. And it's quite a scary place to navigate, like you say, especially when you don't look that sick. When I went through the start of my experience with this, I just found that I would often gaslight myself because of how I flip-flopped back and forth between feeling at one end of the scale and then the next day being like, oh, well, hold on, I just did a really big walk. So I was just walking for an hour and a half, but it didn't feel great. And I know in the past that, I used to get up and go for a 10K run or, go and smash a workout. And live a very active life. So when you compare and contrast, you have to look at the metrics that you've got, which is your previous experience. And in comparison, seeing a walk as an achievement, well, that suggests to me that something's definitely not right, because I've always been the active person. I've always been the person that loves being out and about, full of energy, likes to do things, likes to spend time with people. But it makes you so insular, and it makes you question, especially after a number of encounters with doctors who, as you experienced and many other women and people experience, you do start to question yourself. You really do. Yeah. And you have to have such a strong sense of self, and you have to really, really, really have some resilience in advocating for yourself in order to actually not just take no for an answer and keep going back. And then I feel like you're kind of stuck between a bit of a rock and a hard place, because I think as women, you go to the doctor, or just in life in general, from this legacy conditioning that we have, we feel like we need to be good. And so you go to the doctor and you want to be good, and you want to be the good patient, and you want to go in, and as awful as you feel, you want to still say, this is what's happening, and be really calm and rational and objective about it, and not really scream and shout and say, oh my God, this is awful. This is no quality of life. But then we do ourselves a disservice, because we just get fobbed off with, oh, well, you're actually fine. And she seems like she's a pretty passive person, so she probably isn't going to make much of a fuss. And then after encounters like that, you then go back and you're like, you know what? I'm going to go at the other end of the spectrum. I'm going to go in and I am going to insist that we do something about this. And then you get put in the hysterical basket. Oh, it must be psychological. Let's suggest some antidepressants and send her on her way. And the scary thing is that if you didn't have a really strong sense of self, and you weren't that aware, and you were very susceptible, which, I mean, it's easy to get sucked into it.
Yes.
You could just say, all right, yeah, I'll take them. Oh, that's what's wrong. That you're right. You know, it's not a real visceral physical condition. It's just in my head. You're quite right. And it's so scary. And I love that you, in the book, you document your journey of just going through this process and time again being, oh God, rejected and just mistreated and just gaslit. And I guess it's really impressive that you kept going. And I guess I'm just interested to know how you found that strength and how you found that tenacity to keep persisting when it wasn't just a couple of no's, a couple of shut doors. It was a consistent process for a really long time of your life.
Yeah, well, so first, sometimes I feel like I am really strong and I've built up this really strong sense of self. But I also want to acknowledge that I don't always feel that way. Like, it is very easy for somebody who is some Mayo Clinic doctor or some very, very well accredited doctor to just puncture this immaculate like balloon of self-respect that you have built up over the years, that all of a sudden can just get popped by somebody with a really cutting remark or something like that. And it takes a while to kind of build things back up. And I think that for me, in the beginning, I didn't even realize how much this was damaging my psyche to be told over and over and over again, this isn't happening to you. This isn't real. You're hysterical. You're a liar. You're a malingerer. You're whatever. I would feel quite badly, but it did not occur to me in, I would say, the first half of the journey of the first 10 years. It really did not occur to me that there wasn't a problem with me. There was a problem with them. And that they had, as I say in the book, doctors really do have like algorithmic thinking. It's like the only way to be a doctor in modern medicine, because you have to basically be a little computer that churns patients, way too many patients in and out of the office all day long. And so you can't really think holistically about this person sitting in front of you. You have to just say, okay, give me your top 3 symptoms. Okay, I'm going to run that through the computer in my mind, bang out what I think the top likely thing is, and then on your way. And so I think what's happened is that to fit into that model of essentially reimbursement with insurance, there's an algorithm that is incorrectly programmed, which is that, oh, fatigue, oh, pain, oh, no diagnosis. And then it spits out, oh, anxious, depressed, right? Which is something that they have a pill for, right? There is something something that they can kind of give you while they're rotating you out of the office. And it really simplifies things. And importantly, what it doesn't do is threaten their own sense of knowingness and I know everything and I'm the authority and I'm a doctor, which is, I have found, a very real issue. I wish that I could walk around with Ramey's big book of DSM codes. That's number one would be fragile ego syndrome. 80% of FES patients are male, it turns out, and that's real. And that is a very real problem where they can't bring themselves to say, I don't know. Or even just to say, doctors frequently ask me this. They're like, well, if I don't actually know what's wrong with them, like, what do you want me to say? I'm like, number one, that you need to say, I don't know, and be honest, because you don't want to say, I don't know, instead saying, therefore you're making it up, is wrong. That is medical abuse. You cannot do that. Nobody else can say, the dentist can say, I don't know what's wrong with you. When in reality, you've got a horrible cavity that's causing all of this pain. If they just only told people with cavities, like, you're making it up, that's malpractice. That's wrong. That's the wrong response. You can't just say that when you don't know. But they do. And what I frequently say to doctors is, well, I understand the need to, even just in the most generous interpretation, my dad kind of explained this to me. He was like, well, even for like placebo effect, your patients really need to believe that you are the authority and that you know what's right and what's wrong. And that actually, we think, helps with even the treatments that we know work because the medications work. But the efficacy is actually boosted by the patient believing that we know what we're doing. And he's like, and you can see the efficacy go down in certain studies, where patients are really, really disbelieving of their doctor's authority. And so I was, okay, well, that's fine. But that doesn't rule out you just saying, well, what it sounds like to me is that you've got one of these illnesses, whether it's chronic fatigue syndrome, fibromyalgia, Lyme, et cetera. And this area of medicine has been pretty catastrophically under-researched and underfunded and is very poorly understood. And it's a real problem that the medical system has. And I want you to know that I know that and that I believe you. I'm sorry that this is happening to you. That said, because the research is so limited, there isn't a lot that I can do for you. But let's think through, is there anything that I can do? Can I get you to a pain management person to help manage some of the pain? Is there anybody in the area that does specialize in some of these problems? Because sometimes there does. It's not that common, but sometimes there does. Yeah. And they can at least be a benevolent force of helping you through the darkness. And instead of just leaving you alone, cutting you adrift in the darkness, being like, see ya, you're made it all up. I don't ever want to see you again. And it's funny when I talk to doctors, they're like, because I'm like, that sentence that I just rattled off, that was about a minute. This is not expensive. This is not taking you more time or energy or empathy or anything. You just need to change the algorithm in your own head when you hear these symptoms and notice that it's probably a woman, to go from saying, you don't have to put anything off the table. Sometimes antidepressants can be helpful for people, but it's important not to reduce their entire illness down to, oh, this is just a manifestation of your depression or your anxiety. And those are, you can do that. You're a doctor, you've got many degrees, you can speak with nuance. Like, this is possible. It doesn't need to be so abusive. I really do think that there is not a better word for telling somebody who is actually very sick, no, you're not, no, you're not, no, you're not. I think that is just wrong. And it's important to say that and to not kind of mince words around that, because every single doctor that I know that has had the tables flipped on them and they suddenly become a WOMI or a MOMI or a POMI, they are just like, oh my God, this is hell on earth. This is so bad. Doctors are horrible to patients like this. Did I do this? And I'm like, yes, you probably did, but you are probably the most effective advocate for going back to your colleagues and saying, we have to stop. We must stop doing this to patients because it adds so much insult to injury.
Oh, it really does. Yeah, it's interesting that you point out the role that ego potentially has to play here. And I get it to a degree. Humans in general, we don't like to admit that we don't know, we don't like to be wrong. But when you're in such a position of responsibility to be taking care of another human being, it just can't continue to happen. And I think to your point, like it's about just coming to the table and keeping that dialogue open. It just because they don't have the answers there and then, just knowing that you feel seen and heard and that that person wants to give you some next steps. And that might be a referral and it might be something else, but just to know that that conversation isn't closed, it's open. We're going to be curious here. We're going to look at lots of different avenues that we can take. And the mental relief that even just being seen and heard can, the impacts that that can have on a person is transformative. And like I had an amazing doctor from Melbourne on the show a couple of weeks ago, Dr. Moyes Shiwa, and our entire conversation was framed around the encounter that I'd had with him, which was one of empathy, of compassion, and the power that humanity and treating patients with humanity has. Because I'd said to him, prior to him, that I'd never had a doctor's experience like that. And I'd almost gone into it. You go into it with these preconceived notions that you're not going to get the answers that you want. You're almost just kind of going in thinking, oh, bloody hell, here we go again. But he sat me down and looked me in the eye and genuinely listened to what I had to say. And I walked away from our consultation, with no more answers than I had 15 minutes prior to walking in. But I felt differently. There was a shift and it felt like I was being taken seriously finally. And the empathy that he bestowed upon me, it was really transformative. And I later found out that actually that is Moyes Shiwa's entire approach. And he's written a book on it. And he's been working with Warner on a course in clinical confidence, which is all about like how we can optimize this patient-physician encounter, which is broken. Like the relationship's broken at the moment. And I just think the power of empathy, which is something that you kind of pick up on in the book as well. And you had your encounter with, was it Dr. Wonderful? She was the first.
Dr. Wonderful. Yeah. Well, I think one thing that you're identifying that is so important is that it is so important for a doctor to understand the harm that is being done via disbelief, that is extremely painful for a patient. And that is not because they're weak. That is a super normal response to be hurt and extremely afraid that your doctor doesn't believe you. I frequently say it is not different than calling the fire department and they pick up and you say, my house is on fire. And they say, no, I don't buy it. And they hang up. That is extremely scary because your house is going to burn down then. And that is exactly what happens to your body if the doctors just close the door in your face. So it is normal to feel really badly, like not just about yourself, not just, oh, something is wrong with me, but just afraid at a deep reptilian level that the person that is charged with taking care of you is telling you that it's not even happening at all. Like that is so scary. And you should not do that to patients unless you are 1000% sure that that's what's going on here. So you've got like a very severe case of hypochondria or mental illness or something like that. But that's very rare. Like I have met at this point thousands of WOMIs, and most of them, like 99% of these patients are just, maybe they have a little bit of depression or anxiety, but this is not a case of very severe mental illness where anyone is so misperceiving, the world around them that they've imagined this severe illness that actually isn't there. And so it's really important for doctors to not keep acting as if that's what's going on when that's not based on anything, when that's just based on their own assumptions and really their own feelings. It's like they have a feeling about this type of woman usually, and that feeling then translates into really poor treatment. But if you have a feeling, that gets medicated right away. And I always just want to be like, oh, can we talk about your feelings? Because I feel like they're getting in the way here. But we don't talk about that. We don't talk about your feelings, the way you feel about me, the assumptions you have about this type of illness, like et cetera, et cetera, et cetera, because they don't have to examine that. And I think especially in this profession, it's one thing if you're an accountant and you don't examine your feelings and your bias. That's one thing. If you're a doctor, that needs to be part of the training, is really teaching you to be aware of your own biases, aware of the necessity of taking care of this person's sort of fragile feelings in front of you, because that's part of your charge. And also having some training. Right now, medicine almost like self-selects out people who are more empathetic. It's like, oh, this isn't the place for you, which is really, really crazy. This is a job that should be one of the number one skills that like bumps you to the head of the line. I can see that in medical research, empathy not being as important. That's fine. That's fine with me. If you work in a lab and you have no empathy whatsoever, no problem. That is okay with me. But as a doctor that has to interface with human beings who are suffering, it cannot be that that's not in your skill set, that you don't know how to be empathetic, that you're not strong enough to have empathy, because it does take a lot of emotional intelligence and skill and strength. And I think a lot of doctors either don't have that or they shut it off because it's too overwhelming to deal with so much suffering all the time. And I've had so many of my friends who are doctors say that to me, and I'm like, okay, I do understand that. I think that it's a very difficult profession. That does not justify turning off this important skill in this profession. There should be just more buttressed support around empathy training in medicine instead of just saying, oh, we're just not going to do that anymore because it's hard.
100%. Yeah. The word empathy, it's quite an interesting one. And I love in the book how you try and reframe these, I guess, stereotypically more feminine qualities and characteristics, especially with words like empathy. And it's something that I relate to quite strongly as an empath. But also, I'm very conscious that being empathetic and being, I guess, more sensitive, that doesn't replace being strong. It doesn't replace being pragmatic. No. In fact, I think those are qualities of those very traits. Like you can be sensitive and strong, sensitive and rational. These things can coexist. But I think there's so much misconception around these type of words, and that might be another barrier to why doctors are not necessarily wanting to go down that path. I felt like this is probably coming from a bit of a selfish perspective here, because I actually had an experience the other day, and it not in a medical context, actually in a work context, where we as a team did this strengths finder analysis. You know, companies like to make their workforce do them every now and again. You do the quiz, it spits out your top 5 strengths, and then you come together and discuss them and discuss, you know, how you can work better together based on the strengths that you've got, how they complement each other, etc. And I had one that nobody else had, which was empathy. And because it's a slightly, I guess, especially in a corporate workplace, empathy, I guess, maybe isn't top of the value chain. It's not something that's perceived as super valuable when you're in business. And so we did a whole workshop on the findings of this analysis. And one of the focus areas was on this word empathy and what the barriers are to that word. And the facilitator had us go around and say, all right, what was the first thought that popped into your mind when this word came up? And, you know, it's the kind of pushover, tree hugger. Somebody said kumbaya. And so these are all of these things that people just unconsciously thinking when these words come about. And even in this day and age, and so the whole kind of workshop was just about like, let's like reframe that. Actually, empathy is an amazing connecting, unifying thing that we actually need in every context to bring some humanity and to bring some connection into all of the experiences we have. I found it very, very interesting that we do still grapple with these more feminine characteristics. How do you sit with that?
Yeah, well, as you know, I read a lot about this in the book. And, you know, I would say the part of the book that's like the most caveats in the book. We're talking about stereotypical understandings of masculine versus feminine. This is not about if you are a man, you do have these qualities. Maybe more likely, maybe because of social conditioning, maybe because of a little bit of biological influence. We don't totally know the answer to that, but we do know that these characteristics are associated, if they're masculine, more so with men, and if they're feminine, more so with women, stereotypically. And the characteristics that are associated with the feminine are, if you just go on down the line, sensitivity, empathy, being more collaborative, being more cyclical rather than linear, like on down the line, these are all considered lesser than their masculine counterparts of being more logical, more rational, more linear, more goal oriented. Those are all, especially in a work environment, those are all at the top of the food chain. And at the bottom of the food chain are all these feminine qualities that are, they're not always denigrated exactly. They're just lesser. They're like nice to haves, not need to haves. Like that's how I think most people would think about, which is, in my very strong opinion, this is a big part of like what's so out of balance in so many areas of modern life, is that femininity is just so undervalued. And these values, regardless of gender, anything like that, these values in a culture, in an individual, are meant to be in balance with each other. And so the logical mind, so for example, the part of you, if you're a doctor, it's like, okay, you're sick, let's run some tests and figure it out. We want to look at the data, right? That's a totally reasonable response. But if you run those tests and the data is all normal, but you come back and this patient is clearly suffering in front of you, it is not logical to then say, and therefore, Ms. Ramey, you are not sick, nothing is wrong, go home and don't come back. An empathetic person would say, well, the data doesn't show anything, but clearly you wouldn't have spent all this time and money to come see me today if you weren't really suffering. And so I'm going to stick with you and we're going to try to figure this out. That's an empathetic response, which is being able to understand and get into the shoes of the person who is feeling the pain. And to your earlier point, that is seen as like a frilly, frou-frou quality, when in reality, to get down into somebody else's pain and sit there with them takes enormous strength. And the people who don't do that are universally have real emotional fragility. They cannot do it. It makes them disintegrate having to go down and sit with somebody else in their pain. I know a lot of people like this who, if you cry in front of them, they're like, oh, no, 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 no. Like they just can't stand it. And it really, really affects them and undoes them. Whereas somebody who has a real fluency with empathy, that's not what they do. They can sit there right with you. They're not going to take it all on. I would say empaths do take it on, but I feel like advanced empaths are able to feel what the other person is feeling, right, without letting it just like totally dissolve
take
them.
over.
Right. But again, that's part of that developing that emotional skill as a strength, as opposed to just a feeling that you're having. It's a real asset if you can use it to help other people and to help them feel seen, to help them feel not alone, to be with them in their suffering. This is such an important superpower. So for me, whenever people denigrate it, I'm just like, man, this just drives me crazy because it's wrong and it causes damage. We would all be, I think, so much healthier. And it's not to overvalue feminine traits. It's not like they are meant to be like, oh, we put some on top and some on the bottom. It's like, no, 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 no. They're just all equal. They're just all equal and they work well in partnership with each other, in balance with each other. And that is, to me, it's like really straightforward. But to a lot of people, they don't see it that way because it is pretty woo-woo, I think, to think about things in terms of masculine and feminine. So even just that, to do that, to think about the masculine and the feminine is like a feminine thing to do. And so people don't do that. And they're like, oh, that's such a stupid thing to do. But then it's not conscious to them which traits are feminine and which traits are masculine. So it's not conscious to them that they actually do have a hierarchy of traits And they really are overvaluing these masculine traits and undervaluing these feminine traits in a way that's just not even like above the threshold of consciousness for them. And so to me, that's the reason this is like one woo-woo thing where I'm like, no, this one I actually think is really salient and relevant even to the most rational, logical person, because it's hard to deny that this is just part of the fabric of human life. And so it's important to be aware of it because it helps you come into balance with yourself and with other people.
Yeah. And I think there probably is still a fair way to go with the reframing of these types of characteristics. And I mean, like, I'll be the first to admit that when I received my strengths on my Strengths Finder analysis, when I saw the top 5, I was like, oh, typical. It's just me all over, there's connectedness, there's empathy, and it's not typically traits that one would associate with the business world of being a white collar worker. But I think, look, we all just need to check ourselves and leave the barriers that we've got at the door, because as you said, we need, I think society now more than ever needs more people that can tap into that skill, which does take a lot of strength. And I love in the book when you say empathy is not sugary or sweet or nice. It's about the strength it takes to go down and be with the dog. And I think that just encapsulates it so perfectly. I would love if you could tell us a little bit, whilst we're on the topic of reframing the feminine narrative, because I know that there's a fair bit of work that went into looking into what the heroine's journey might look like after realizing that there was probably a bit of a gap in the market for the heroine's journey. There's a lot around the hero's journey. And, you speak of Joseph Campbell's work and all of the narratives that there is a notable lack of female presence, I think it's fair to say. Can you just tell us about the journey that led you to uncovering the heroine's journey?
Yes. So there's a section about the heroine's journey in the book that is a mini book within the book. That book could have probably been expanded into a whole book, because to me, it was this whole 2-year sojourn into this other area of study that had nothing to do with medicine.
Hey, you should do it. I would totally read it.
But it felt so important to me to do this because I was not just on the health journey and trying to understand that and have this narrative in my head. It's because I was also writing about it. Because for somebody who hasn't read the book, I wrote this book while sick. I mean, I've been sick the entire time I was writing it. And so I just sort of like was in it the entire time. I wasn't like looking back on this bad thing that happened to me a long time ago. So I was really struggling while writing the book to find the shape of it. And in the beginning, very consciously modeled it around, well, I'm going to do what, all great Hollywood writers do. I'm going to model it around the hero's journey, because I think that this does have something in common with the hero's journey. Like, it is this big epic journey, like having a big illness. I think most people who have grappled with serious illness, it does feel like it's this kind of special removed journey that's different from mundane life. But also you kind of want that. You like want it to not be mundane and meaningless. Like you want it to have some sort of sheen of specialness to it. So it's not just a big pile of shit. And so I had been structuring the whole thing around the hero's journey consciously, but not super consciously, but consciously. But then, and then I sold the book. My health just collapsed a couple of times, like once in 2010 and 11. And then again, really badly in 2013. That was when I was, like I was saying, unable to lift my head off the pillow in a wheelchair, etc. And in that second collapse, it was a true living death. I just could barely open my eyes. I was just felt like I was barely alive. And I was supposed to be writing a book. I was like, I can't even eat soup without assistance. Like, how am I going to write a book? And also, how in the world is this going to end with me slaying the dragon of illness? Because this is very important for the ending of my book, is that I have to really solve not just my illness, but all chronic illness. Like in my head, that was not like a crazy idea.
It's a pretty tall order.
Yeah, but it seemed, I was like, if anyone can do it, I can do it, which is obviously ludicrous, but I felt like I had just taken this project on and I could do it. I really felt like I could do it. And so anyway, obviously I could not. I was just in a puddle of my own piss and shit and was just absolutely in the worst possible place of my life. And as I was in that place, I was like, well, what am I going to do about the book? I had to write to my editor and say, I have to take a leave. I'm not going to be able to turn this in anytime soon. But also, how am I going to finish this book? Like, what's it even about anymore? What's the meaning of this? There's no special shimmer to this journey. This journey sucks. So I started trying to look at other ways that I could structure the journey and other common narrative forms. And it occurred to me, I was like, well, is there a heroine's journey? Maybe that's just it, that there's some other journey that is inherent to women or something like that. And at first I was like, yeah, it's all these women who essentially are women who go on the hero's journey. They just have different bodies, but they go on the hero's journey. And I realized, no, that's not it. That's the same exact journey. It's just women. And then I did some digging around on Amazon. I found this book called The Heroine's Journey and I bought it. I started reading it. And it was, as I say in the book, it was all the hairs on the back of my neck stood up. I started reading about it. I was like, oh my God, this is it. And the story of the heroine's journey is not the story of Luke Skywalker or Frodo or any of these sort of gallant heroes that head off into this dangerous land, slay the dragon, and save the Shire. The heroine's journey is the descent into hell. And it's Persephone's journey, or the journey of becoming the bride of hell, or the one who descends into hell and then ascends in spring. And to me, when I was like, the bride of hell, it's like, that's me. It's like, we've got it. But then I really started reading this book, but then a whole bunch of other books that were about essentially this story, which is, it's exactly the same as the hero's journey in that this story of usually a woman who is abducted or consciously descends into the underworld, like Persephone or Inanna, or there's a variety of other goddesses around the world that have the exact same story in every culture, which is not all that common in mythologies. There's lots of sort of threads in different mythologies that are kind of similar in different stories, but the heroine's journey, like the hero's journey, really does show up in extremely similar forms in so many different cultures. And so it's about the story of Persephone, who is this young goddess who is abducted by Hades into the underworld against her will. And to make a long story short, she becomes this goddess that is allowed to ascend to the upper world for half the year, but then always has to return to the underworld every year. And it begins with this horrible trauma of basically being raped and abducted by the god of hell. But then over time, what she becomes is not only the goddess of rebirth, of spring, but also the goddess that descends every year and begins to accompany the new souls that are new to the underworld and guides them through hell, much like Beatrice or Virgil in Dante's Inferno. It becomes, this person becomes the guide that guides other people through the darkness as they are making their way through the darkness. And what other people have interpreted, and I sort of put together my own interpretation of all of this, is that this is this person who a terrible thing has happened to, an enormous trauma, but the real initiation into becoming the heroine is that she or he or they don't get stuck in hell. They continue to move through and can travel into the upper world, but then can travel into the underworld, into the darkness, which I interpret to be a metaphor for traveling inwards, traveling into the psyche, into the body, but also into the cultural psyche, into the cultural body, and to becoming this person who can essentially see in the darkness and can thrive in the darkness and can be strong in the darkness, which is a very different relationship to darkness than in the hero's journey. In the hero's journey, you've got good, light versus evil. And it is like a battle to extinguish the darkness, to put it out. And if you are dealing with something like illness or systemic problems like sexism or racism or any type of ism, dealing with those darknesses, trying to extinguish them, does not work. It's just not the way that it works. And the way that I think about it is that traveling into the underworld is essentially traveling into the root system. And this is down in the place where that's opaque, that we can't see, but is actually where all of our health comes from, whether that's logical, your psychological roots, or your physical roots. So being this person that comes down into the darkness is somebody that is comfortable in the darkness and isn't trying to kill it, isn't saying, oh, this is hell. No, it's just the underworld. It's just the part of the world that is naturally darker, but just as important. And this place that is very important to be able to navigate with eyes wide open, to look at what's not right and to look at what needs to be fixed in the root system so that things can thrive in the upper world, up in the light. And that's exactly what a good therapist does. That's exactly what a good doctor should do. They should not be squishing down your symptoms in the upper world, trying to make you better by pushing a symptom down like whack-a-mole. They should be going down into the root system to figure out what is truly causing this, what is actually the cause of what's going on. And this is something that I think a good functional medicine doctor does, different types of doctors that really care about these types of problems. They do try to get down to the root. And so this, to me, this is heroinic behavior. These are people usually initiated in by their own illness, by a trauma, by something bad, just like Persephone. A lot of people are like, oh, don't talk about Persephone's initiation there. Don't say that she was raped. No, I think that's the right
Relevant
metaphor. Yes, it's a horrible thing that was out of her control that happened, but she doesn't allow it to break her. And she uses it to become stronger and wiser and to help other people who are also traveling through the same dark path, which is exactly what you see with so many people who have chronic illnesses, is that so many people get initiated into becoming somebody that starts to help. It's what you're doing. It starts to help other people with their own journey through the darkness, to help them feel not alone, to help them see in the dark, and to just help them feel a sense of safety in a situation that is otherwise terrifying, because it is hellish. It is very, very scary in the dark and in the underworld. But that's what the purpose of this like grand heroinic character is. And it is, to me, it's like, that is like just as epic as the hero's journey. It's just, you don't see it represented almost at all in any type of storytelling at all. And I think I'm so interested if we'll start to see more storytelling as you see sort of like women on the ascent, and as you see more trauma stories starting to like ascend, we'll start to change the way that we tell stories so that it reflects this a little bit more.
Yeah, that's it, isn't it? It's about sharing the suffering to make others feel less alone and to foster that sense of unity and connection. And I hope that we do. I know we've briefly touched on this, but the point of the podcast was to share not only my experiences at a high level, but get to showcase other people like you who have gone on this journey. And it's not a neat hero's journey type situation. It's messy and it's raw, and it's about the descent. I love the notion that it's not about trying to slay the dark or kill the dragon. It's actually about learning to just be with that. And then that is a catalyst for you to rise up. And there's so much power in that. And it's liberating and refreshing to sort of, I guess, let go of some of the things that we're taught as women, particularly, that we should be doing to get ourselves better. Like, let's just be positive. Let's just be, nice, and it'll all go away. You just need to do a few manifestations, a few affirmations, some positive thinking, and, just give it a week and you'll be all right. And I've heard you speak before how you've really, really, really let go of that, and you've really lent into the power of negative thinking.
Yeah.
I would love if you could talk to us a bit about that.
Yeah. So to clarify, there's a podcast that is called The Power of Negative Thinking with me. And it just says that on it. And it's like Sarah Ramey and The Power of Negative Thinking. I'm like, that looks much worse than it is.
Yeah. I'm totally guilty. That's what I saw. I was like, whoa, she's really gone for an angle there.
I did not make that poster. I was like, can I even repost this? I feel like I need to explain. So the power of negative thinking is actually, it's still positive. It's just a different type of positivity. It's more realism. It's being able to talk about things as they actually are, to call things bad when they are bad, and to say that something is shitty or painful or terrible when it is in reality shitty or painful or terrible. And to allow yourself to be able to do that, to not force yourself, because there really is this culture in the healing world of, people would say toxic positivity now, of just sort of positivity at all costs. That this is the way that you heal yourself. And so you have to just think positive, 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 which I did. I mean, I was an adherent to that cult essentially for years. I mean, for a long time until I think I'm hurting myself with this. I think that I'm flagellating myself with this. I'm not getting any better. It's not helping my health at all. And I'm letting these little thoughts in my mind bubble up every time I'm in a lot of pain. A little thought bubbles up in my head, like, must be that you haven't resolved your mommy issues, or must be that, you've got some negative thoughts bumping around in your head. And this is just a completely ludicrous way to conceptualize illness, because every human being has some negative thoughts bumping around in their head. And of course, it is healthy and helpful, I think, to help people get out of being stuck in negativity and sort of Eeyoreishness. I think that that can be helpful. And I want to distinguish this between clinical depression and being like stuck in a very serious, severe depression. That's different. And it requires, I think, a different, more nuanced approach. I'm talking about just being upset that you are in a lot of pain, or upset that you are really sick. I think it's very important for yourself to allow yourself to be sick and upset and in pain, and to not squash that and squish that and try to say, it's okay, it's okay, it's okay, it's okay, when it's not okay. I think it's very important just for your psychological health to be honest that something is really bad. And then the next step, we talk about this in the book, to have people in your life, whether it's a therapist or a good friend or a family member or all of those things, to witness that back to you, to be a mirror that is not going to say, well, at least you don't have cancer also, or at least you have a roof over your head, or who's not going to minimize it, who can sit with, again, who can be that person who climbs down into the darkness with you and witnesses back to you, mirrors back to you, yeah, this fucking sucks. This is terrible. And I think to a lot of people who have not suffered enough, that sounds bad. They're like, oh, that's going to make them feel worse. In my long experience and experience with most people, that is not true. That makes them feel much better. It makes them feel seen, like you were saying before. Being seen and heard is a critical function in the psyche. I think that that is something that has to happen in order to move on, in order to ascend back into the upper world. Yeah. You first have to have that pain and suffering acknowledged. That is 100% true for me. And I know that that's true for most, not all. I don't want to paint with too broad a brush, but most people I know who are womies, that's true for them too. They don't want to sit and wallow in it. They just need it to be acknowledged at all. Yeah. And that's what is so hard to come by with a lot of people, is that so many people, usually with goodish intentions, they're trying to make you feel better. So they're like, oh, I'm hurting and I'm in a lot of pain. And they're like, well, but on the positive side, there's a new episode of Succession tonight. And it's like, yeah. Okay, yeah. That's not what I need to hear.
The inherent need to fix, isn't it? Because it makes people feel very uncomfortable to just sit there and just be with you in your pain, much as the heroine's journey speaks to. It's just such a reflex that we're like, what about this? What about that? And I'm definitely guilty in the past of doing that to myself
too,
and doing
that.
Yes. Yeah. But you kind of do learn. And I spoke a fair bit to Kimberly Warner about this because she's obviously created Unfixed Media, which is just all about kind of celebrating our beautiful brokenness and our unfixed parts and not trying to be perfect, just letting it all be there. But I think it's hard, I think it's difficult for people to know what to do in a situation where if they haven't experienced something like this, then they might not know the best course of action or the best way that they can support the people in their lives that are going through this.
Yeah.
And I think obviously these conversations go a certain way and hopefully educating flomies, as you've called them before, friends. Just kind of, educating them as to how they can best support. Could you just round that out for us from your experience of going through this for such a long time and still going through it to this day? How can flomies best support?
Yeah. So the first thing is really understanding just the concept of witness. Like we were just saying, it's really just mirroring back to somebody. I have a whole chapter about this in the book of just mirroring back to somebody exactly what they're already saying and acknowledging that it's bad and that you agree with them and you are affirming that the thing that they're feeling is bad and they have every right to feel depressed, sad, angry, whatever they're feeling, that is legitimate and that you mirror that back to them with words. And then I think that what I do, because like I was saying before, because I have a lot of friends that are sick, people are different and people need different things emotionally when they're suffering. And so when I have friends who are newly diagnosed wellmies or with cancer or whatever it is, and I want to be there for them, what I always do is I just talk to them and I say, hey, I am here for you. Number one, I'm going to be your ride or die for however long you have this, whether it's the next year or the next 70 years of your life. Not that I'm going to live for 70 more years, but however long it is that we're together, I'm here for you. I want to talk to you about what feels good to you in terms of what you're needing from a friend right now. Like, is it helpful? Do you need somebody that's going to say, yes, this sucks and can sit in the shit with you? Do you need somebody that's actually just keeping things positive all the time? Because for some people, that's where they're at. They're like, I just want to think that I'm going to get through this, that I'm going to be okay, and that it's going to all be okay. And that's their decision. I'm not going to say like, well, actually, I think you'd be better off wallowing down in the shit. What I might say to them is, I will absolutely do that. And if you change your mind, you just tell me because I can do both. And I want to do what feels best for you. Is it best to just not talk about it at all and to just talk about, do you want somebody that just sends you, TV recommendations or funny articles or YouTube videos or whatever it is?
Yeah.
Like, what are the things? Let's explore around the ideal friend situation in your mind while you're going through this difficult thing. Because for me, it's skin off my nose, right? I would much rather know and have a sense of it. And I tend to check in over time of like, does this still feel good the way that I'm doing it? And that works so much better. And it's so much better for me because a lot of people, when they're a FWOMI, they feel like they're walking on eggshells all the time. Even if that person's not doing anything to make them feel that way, they're just like, oh my God, am I saying the wrong thing? Am I doing it wrong? Am I making it worse? And that can cause friends to pull away because they don't know what to do and they don't know what to say. And they don't want to make it worse. And so they will just stop doing anything. And that is like the worst thing that can happen.
Yeah.
And so I really think the greatest gift like a FWOMI can give to a WOMI or to anybody that's sick is to just have like a really open channel of communication and to say, I'm here for you, whether it's to witness you or it's to be your cheerleader or whatever it is. I want to talk about that with you. And another thing I usually offer as like a service to friends who are suffering is to just be like the trash can for them. They'll say, is the trash can open? And I'll say, yeah, the trash can is open. And then they just dump all the stuff. Like I went to the doctor and he was mean to me and then my sister was mean to me. And, and they just have to get it all out. And
that's important.
very important. And it's something that really is not, now, I'm sure some people could abuse that
Yeah.
act of friendship. And so you have to be maybe careful with your time or boundaries around that. But if it's somebody you think would respect the trash can
Mhm.
principles, I think that's something that's helped my friends the most is somebody that they know is not going to disintegrate if they dump their
Yeah.
darkness on them because I can take it. It doesn't bother me. I'm like, let it all out. I'm here. I'm Oscar the Grouch. I live in a trash can. I can take it. It's fine.
It's so important, I think. And it's quite funny that you say that because I literally have a group chat with a couple of close girlfriends called the shit sharers. And
Yes.
anytime we're having a bad day, and it could be, it might not be even illness related, it might just be general inconveniences in our day. And it's a safe space to go and leave a voice note and let it all out. And then you feel it's amazing how cathartic it is.
So therapeutic. It's so helpful. So that is a real service that one can offer as a friend. It really doesn't take a lot of time or energy. It's just, but it really does help the other person. And I have to say, as somebody who deals with a lot of suffering and has a pretty full personal trash can, hearing other people suffering for me is almost helpful because it's like I am not the only person that has all this stuff, and I can take my mind off of my own problems to help somebody else with theirs for a little while.
And I think nobody bonds over perfection and things going smoothly all the time. It's great to hear when things do, but ultimately the times when you deeply connect with another person is often when something isn't going so right and you're reaching out in a time of need and, you meet them there. Thank you. I think that's some really great tangible advice for FOMIs. And I'm just going to touch upon, and we won't go too far into this because I appreciate that, as with your journey, every WOMI's journey is completely different. And so what kind of best course of action is so subjective. And we've mentioned functional medicine as one thing that particularly helped you. But again, it helps you. It might not necessarily help the next person. But do you reckon at a high level, you could just explain a little bit about functional medicine?
Sure. So functional medicine is essentially, I think of it as the next iteration of integrative medicine. It's like a more evidence-based, data-based version of integrative medicine because integrative medicine has a lot of good ideas, but the 1.0 version of it has really been catch-all. Like everything goes in the integrative medicine basket of alternative healing. And what functional medicine is really starting to kind of drill down on the things that the data is really telling us about what's going on with chronic illness. So, for example, like we talked about before with the microbiome, gut dysbiosis and problems in the microbiome really do appear to be associated with the development of this type of chronic illness, of the mysterious illnesses, but also autoimmunity and other illnesses. So, what functional medicine does is it focuses on these key areas that have been identified as being the real points of leverage when it comes to how can we actually help these people instead of just giving them some turmeric and sending them to an acupuncturist, which is very common. If you defect from regular medicine, you sort of end up in the wild west of alternative medicine where anything goes. There's no rules, there's no guidelines, there's no data. It's a free for all that attaches, gets little tentacles to your wallet and just starts sucking. And it's like really tough because you want to get better. And so it just depends on your means. I know people who are extremely wealthy and they have spent an enormous amount of money and still didn't get better. And I know people who don't have any money and so they weren't able to spend very much money at all. And of course, they didn't get better. But some people do get better. And so, what functional medicine, in my opinion, is, and it's not a be all end all, it's just a more edited version of alternative medicine that is narrowing down what treatments really seem to help people, particularly in the mystery category, what seems to help them. So narrowing in on the microbiome and helping people, fix what's going on in their gut, usually with diet and maybe some herbal intervention. Also, the HPA axis. This is your hypothalamic pituitary adrenal axis, and this is essentially your stress perception center. And this can get dysregulated. And so your cortisol becomes dysregulated, and this causes a number of problems, or it is certainly highly correlated with the number of problems in this category and is thought to be causative. But again, none of this is 100% known for sure. If it was, there'd be no need for any of this anymore. There would be big functional medicine centers and everybody would be healed. But anyways, it focuses in on these different areas, looking at some genetic markers, looking at getting any major toxins, or if you live in a moldy home, this can be causing some of these symptoms. Really just looking at kind of like the known common culprits for what's generating a lot of these symptoms. And what a functional medicine person does is they cast the net pretty wide to try to look at all the common things and see what comes back. See, just like a regular doctor would do, it's just that they're looking at different metrics than a regular doctor would do. But what's so interesting is that each of these things, when I started writing about this a long time ago, a billion years ago, they were all like way out on the fringe, and everybody was like, Sarah, you and your wacky alternative theory, alternative medicine ideas. And as time has gone on, like the microbiome is right in the middle of the mainstream of medicine now. The HPA axis and the relationship of stress to a lot of these chronic illnesses is becoming much more talked about and understood to be a real part of understanding these illnesses, and on and on. And so that is essentially what a functional medicine doctor is. Now, caveat one, very expensive. It is not covered, at least in the United States, by insurance. It probably will be, I would say, within 5 years, but it's not now. And that's an enormous barrier to entry for most people. And that's very real. And that's not fair. But that's not the same thing as it being elitist. Like, I think functional medicine doctors would like it to be covered by insurance. It's just,
it's not there yet.
Not. And so it's the same thing if your regular doctor was not covered by insurance, or you didn't have insurance, it would be 10 times as expensive as a functional medicine doctor to see a regular doctor and go through all those procedures and testing with no insurance. It would be very, very expensive. And so that's the only reason that functional medicine is so expensive. It's just because insurance isn't involved yet. But I can kind of see that that's a dam that it's about to break, just because there's actually been multiple studies done now that show that patients that get functional medicine treatment have much better patient outcomes and disease reversal and things like that. And so it would be better for insurance companies to have healthier clients because it's less expensive for them. And so I think they will start to cover a lot of this stuff because it's in their best interest to have healthier people, because they're the ones that have to foot the bill for a sick patient. Ooh, somebody who's sick for their whole life.
Yeah. And I guess because the barrier there would be the cost to a lot of people, there's also, it's quite empowering to know that the four main systems that have been identified as the drivers of many of the chronic illnesses, things like the gut, the liver, the endocrine system, and the immune system, there are things and lifestyle choices that we can be making which can really, really go quite a long way. And I speak from experience here because when I started going through the experience that I did, I was pretty fortunate in coming across the AIP protocol fairly soon on into my journey. And, things like that. So changing your diet, kind of putting, I guess, every component of your lifestyle under the microscope, reevaluating, reassessing how you're doing things. It sounds really simple, but it's actually not, because, it does take a fair amount of introspection and, being real with yourself and how willing are you to get better. And it's not even about sacrifice, if it enables you to live a better quality of life, then okay, I'll forego the nightshade veggies, or, I'll put the soy products down. But there are a lot of lifestyle things I think that people can do. And I know that you've certainly experimented with quite a few different lifestyle elements.
Yeah, I think, well, you're a great example of AIP. That's the autoimmune protocol. And Amy Myers is a functional, that's whose protocol it is. And it's the person that's the person's protocol who you worked with. And she's a functional medicine doctor. So that's the same framework. And yeah, there is a lot of stuff that you can do on your own that, from my perspective, I think that if I had to start all over again, I would probably start there with changing my diet. At the same time, I would counsel myself that it might not work. And if it doesn't work, that doesn't mean that I have to be even stricter, even more tough on myself about food. Because it's been one of the pitfalls of changing your diet is that you can develop like a really unhealthy relationship with food where like you're afraid of food, or it becomes like an excuse for anorexia, or you become like obsessive about every single ingredient. So it's just something I think to just remember to give yourself a lot of grace, which doesn't mean to just be like, "Oh, I'm going to make up the rules for myself." You do have to follow the rules,
Yeah.
but to just remember to be like soft with yourself about it and not use it as like a new cudgel to beat yourself with, because
Yeah.
that happens. And I think it's just, that's the one thing I would say about that. But it's for the most part free, and it's something you can try. And that's the one thing, is like trying essentially that protocol. That's the one thing that I've seen probably helps the most people when they're self navigating. So that's, I would start there rather than spending your money or your time on Reiki sessions or like on stuff that is like, that's nice to have, but not a need to have. I would definitely start with some of the gut healing protocols and things like that. But again, I think it's also just important to understand that like that stuff is really difficult and it may not work, and there may be other stuff going on. You can't diet your way out of, and diet, we don't mean dieting, it's changing your diet to a healthier, microbiome friendly diet. But you can't microbiome your way out of a moldy home or out of having Lyme disease or,
Absolutely.
right? Like, we know that. But a lot of people, when they're selling their program, they sort of indicate that that's not true, that you absolutely can.
Look, it's like, just one component in a whole spectrum of things that, you should be looking at. Other things like sleep and stress management, or things that are kind of within your control. But of course, there are things that, like you said, you can't, if you're living in a moldy home, then you can be getting 8 hours of deep sleep a night and you'd still not be feeling great. So it's all
sleeping
like
in the mold is not going to heal you.
Not the most healing concept, is it?
No. Mold sheets.
Oh, God. But there's also, components that are also kind of lifestyle based, and some of them are really hard to even come to terms with when you're going through such a hard time. But you speak about human connection in the book and the importance of that, and the importance of, I guess, creativity. And as we know from my very brief comment in the introduction, you are also a musician, and I'm interested to know how big a role that connection and creativity has kind of played in your journey.
Yeah, so definitely both a really big part, and they're more sort of in the soul category, not so much because your soul, if you're reading certain books in alternative health, like if you fix what's going on with your soul's woes, then that's what's going to make you healthy. I do not subscribe, but at the same time, it's very important to take care of your soul when you are sick, because it can really fall by the wayside. It's very easy to fall out of touch with people because they, especially with this type of illness, they don't understand you. There's no pamphlet for FWAMIs to help their friend, as there is for most other serious illnesses. And so it's very easy for friends to fall away and for you to become really isolated because you're protecting your energy. So it's really important to, this is also one of the things that I would have, if I could go back in time and rewind things, I would have grabbed hold of all of my friends and brought them close and been like, don't let go. I am not going to get better. And I need you to know that and not let that be part of what drives us apart. Because I have lost friends who are just so frustrated that they feel like I'm not trying hard enough, which is definitely not true, but they feel like I should try harder, or other friends who they just feel so uncomfortable with sick people and they don't know what to do, or other people who just feel like they don't know how to say the right thing. And so they say nothing. And I've really lost a lot of friends, but I've also reconnected with a lot of friends where instead of allowing myself to be like, well, screw that person. If they can't be here for me in my darkest hour, then I don't need them. That's not true. If there's somebody that this is not true, listen, if they're like a toxic friend and you didn't need them in the first place, let that person go. You don't need them. But if it's actually somebody that you really cared about and that you really loved your friendship with them and they just weren't equipped to deal with you becoming sick, that is somebody that is worth reaching out to say, hey, I really miss you. I really want to be friends with you again if you still want to be friends with me. And I suspect it's probably because of, we're busy, but also that I'm sick. And so I'd love if we could just talk about that, about what it looks like to be friends with me in the way that I am now without you needing to change me or feel sad that I'm sick or anything like that. I just want it to be like it was before, just with less beer and like with less going out. Like, I just still want to be able, I want to hear about your boy problems. I just need you to also want to hear about my bad experience at the doctor. You know what I mean? And that's something I think with a lot of friends, you just have to have this explicit conversation, which I think is hard for a lot of people. That's like scary.
Yeah.
That's a real opportunity for growth as an adult, is to really be willing to fight for the relationships that matter to you and to be willing to say, this is what I need. These are the things that I need. And to be strong enough yourself that you'll be okay if they basically say, I can't give that to you. And I've had maybe 2 people say, I can't give that to you. But most people were like, oh, thank God, I really didn't know what to do. And I felt terrible. And I just missed you. And this has been awful. And blah, blah. And now we're great friends and it's fine. Yeah. But it really took me being the person to reach out and to not be like, well, this is their fault that this happened. And so I'm not going to reach out. So that's number one. And so I think staying really close as you can with people, even if it's in a very limited way, even if it's just that you just text each other, you send each other voice memos, you don't ever see them in person, it really, really makes a difference, because it's really, really easy to become 100% cut off from the rest of the world because you're too sick. So that's number one. And then creativity, that actually is the thing that for me becomes even more important when I'm in those times when I'm more isolated, when I'm more cut off from people and like haven't rebuilt those bridges yet. Those are usually the times that I'm most in my feelings and creativity.
Yeah.
And it is a way to create meaning in a time that is otherwise pretty empty and pretty sad and desolate. Like when you're sick and you're cut off from all the good things in your life, having some type of creative outlet, whether it's just drawing or crocheting or music or painting or whatever you can physically do, because I know can be quite difficult. It's really helpful, or it can be really helpful. It's something worth experimenting with within the parameters of how sick you are.
Awesome. I'm just really conscious of time, Sarah. So I might, and I'm definitely winding down. I've kept you for long enough. I'm just going to hop to the last little section of the show, which is a quick fire round. So it's just 5 fast questions, and then I will let you go and have a rest. I've loved our conversation. So thank you so much so far. So are you ready for the quick fire questions?
I'm ready.
Okay. What's the best and worst advice you've been given?
Best advice is to trust yourself, is to know that what you're feeling is valid and that you are valid, and that you can have 100 people standing in a circle around you telling you that you are not valid and they can all be wrong, because that is what happened to me. That is what happened to most womies that I know. And it's really important to hold on to what you know is true and what you know is valid, and to do whatever you can to not let that get taken away from you. And even if it does get taken away, to claw it back, that you are valid and that you matter and that you know what's true in your own life. The worst advice is definitely like positive vibes only.
Covered that ground.
Yes, we've covered that.
Okay, so what's the biggest lesson you've learned?
I think it's the same. I really think it's to just trust yourself and also to let my own experience of suffering open me to hearing and believing the other experiences of people that I hear around me of suffering. Because, like you said before, when we're younger, when we haven't had these experiences ourselves, we have the same knee jerk reactions that a lot of people have to disbelieve for a variety of reasons. And to really let that, your experience of suffering, to allow that to transform you into somebody that can really believe other people and to be there for other people without being like, show me the data.
Next question. Who or what inspires you the most?
This is a good question. I didn't go through, these and think through my quick finance. Yeah, now I feel bad.
Oh, no, you're fine. It doesn't need to be profound. It can be your cat.
Yeah, my cat is very inspiring. My cat is probably my favorite person in my life.
Yeah, look, completely valid.
Yeah. This is such a funny answer, but this is a true answer. There is this Japanese figure skater named Yuzuru Hanyu, who is the 2-time gold medal winner at the Olympics for men's figure skating and is the most beautiful artist / athlete I've ever seen in my life. And I could say like Malala or Michelle Obama or something like that. I'm obviously inspired by people like that. But creatively, there's something about certain levels of excellence that are just so inspiring to me. And this figure skater, Yuzuru Hanyu, definitely is the answer to that question.
I love asking that question because I always just get such a wide range of responses.
Yes.
It's very good. And finally, what does being mean to you?
What it means to me is to be able to be with all of it, to be with the good and with the bad, like we've talked about, and to be able to accept all the things that happen to me, the good and the bad, and to be able to accept all the things that are a part of me, the good and the bad, and to try to do that with other people as well, and to develop that strength that we were talking about before of being somebody that is more fluent with darkness and that can hold more darkness without rejecting it, without spitting it out or trying to snuff it out. And that to me is where I feel my calmest and where I feel sort of my most whole self.
That's beautiful. Thank you so much for taking the time to come on here and talk to me. We've been talking for a really long time. And even at the start, I was
forever.
I know. I already took up your time at the start of the conversation when I was having ridiculous technical issues, which of course would only happen today. But on it, Sarah Ramey, it's been so wonderful speaking with you. I think mysterious illness or not, this conversation and the book can help so many people in going through whatever they're going through in life. And I love the mindset shift that you've triggered in so many people here. And I just want to thank you very much for not only taking the time to do this, but, you know, the book was 15 years in the making and it was honestly worth every minute of effort that it took to write it. So thank you so much.
Thank you so much. This was such a wonderful conversation and I'm so glad that we made it work. So thank you.
Yeah, thank you so much. And I guess the last thing is, where is the best place that people can find you? Do you have a website, Instagram? What's the best place that people can go?
You can find me on Instagram at Sarah Marie Ramey and on Twitter at Sarah Marie Ramey, probably Instagram. I don't really use social media very much, but I'm trying. It's a New Year's resolution of mine coming up for 2022. So I'm going to speak it into existence right here.
And I'm going to put all of the links to where people can buy your book and links to your Spotify, where people can listen to Wolf Larson. I'll pop all of that in the show notes. So it's super accessible.
Wonderful.
Sarah Ramey, thank you so much.
Thank you so much.